LGBT health education is important for many reasons, mostly that there are many LGBT patients in our community and beyond, and they have special health care needs. And the fact is that most medical schools have an average of less than 5 hours of education for the care of LGBT patients. Additionally, patients are uncomfortable sometimes discussing their sexuality or gender identity with their physician, and physicians are uncomfortable discussing it with their patients because of this lack of education. So to really advance health for LGBT patients across the country and beyond, we really need to increase our education.
The impact of LGBT health education for providers on patients, I think, is huge and can be really easy to do, and really just depends on being able to talk openly with people and be personally welcoming. So for example, another nursing student while I was in school was sort of warned against having this patient who just turned out to be a trans woman who was a great patient to have, and this other nursing student made a point to mention her partner to the patient and just start a conversation around that person's life and their gender expression and their sexuality. And suddenly all of this health information came out. This patient was willing to share some of their life history that was important to know for their care, and it just totally changed the care environment and this person's plan of care and their outcome. And I think it's really simple things like that each and every provider really needs to be able to do.
The Program for LGBT Health is advancing health education in a number of ways. First of all, again, by its mere existence, the program is bringing the notion of LGBT healthcare to the forefront within our university across schools. One thing that the program has already begun doing and is continuing to do is to go to various schools and various meetings within schools and actually do education. As a medical student, you know very little coming into medical school. So it was important for me early on to learn that there are specific needs for LGBT patients. Had I not learned that early on, I think it probably wouldn't have come to the forefront of my mind when I think about caring for these patients in the future. Also, personally, just having the curriculum in there was something that said to me, we care about LGBT people at Penn, whether they're patients who you're caring for or whether they're students or staff. And that was an important message to me.
If you want to learn more about the Penn Medicine Program for LGBT Health, visit us online, pennmedicine.org/LGBT.